Dear viewers, welcome to yet another episode of Afya Yako, a show aimed at creating awareness and educating people on public health issues. Today we have with us Dr. Lekni Pashine, who is a nutritionist and a physiotherapist at the same time, and we'll be discussing on two major topics, osteoporosis and osteoarthritis. Osteoporosis affects 1 in 3 women and 1 in 5 men over the age of 50. It is a growing problem and almost each one of us knows somebody who suffers from this disease. Dr. Lekni, welcome to the show.
Thank you, Dr. Sajjan.
Whenever people talk about osteoporosis and osteoarthritis, a good number of people confuse the two. Could you explain the difference and what is osteoporosis and osteoarthritis?
Osteoporosis is a condition, I should say, Dr. Sajjan, where the strength of bones is lost in a layman's term.
Okay.
When we talk about it's the density which
Okay.
becomes decreased.
Okay.
And the bones become porous.
Become porous.
And that's
Okay.
how the name derived osteoporosis.
Porosis. Okay.
So when they say the bones lost their strength,
Right.
they are very prone to the fractures.
Okay.
They lead many small or bigger fractures,
Okay.
and which causes later on complications.
Okay.
Whereas when we talk about osteoarthritis,
Right.
it is a degenerative joint diseases,
Okay.
which happens with the respect of age,
Mhm.
lack of exercises,
Okay.
and
Maybe if we look at it, osteoarthritis, it is not a main risk factor for fracture as compared to osteoporosis.
yes.
Because in osteoporosis, as you mentioned, the bone density decreases. Is it due to lack of calcium that somebody gets osteoporosis? I mean, many people say osteoporosis is due to lack of calcium, and another reason osteoarthritis is there is due to obesity. So could we look at the risk factors and the causes of both diseases?
Yes, osteoporosis, when we talk about the risk factors,
Okay.
there are many risk factors like family history.
Okay.
There are some drugs
Okay.
who causes osteoporosis.
Okay.
Like corticosteroids,
Okay.
prednisolone is a very common drug
Yes.
which causes osteoporosis.
Porosis. Okay.
Yes, physical inactivity.
Okay.
That also leads to osteoporosis.
Okay.
And lack of well nourished diet, which
Diet.
is supplemented in calcium and
Calcium,
vitamin D,
vitamin
also
D.
causes osteoporosis.
Okay, so these are the main causes of osteoporosis. So mainly inactivity, lack of calcium and vitamin D. So if we look at osteoarthritis, how different is it?
Yeah, osteoarthritis, as I told, it's a degenerative bone disease.
Right.
So it comes after, like we say, during the age, when
Yes.
the young person become aged.
Okay.
Second is physical inactivity. I said obesity.
Uh-huh.
Obesity is again a risk factor and causative agent of osteoarthritis.
Okay.
Osteoarthritis is basically where the cartilage in between the joints,
Yes.
they become depleted,
Okay.
and the bony outgrowth in the joints, formation of bony outgrowths takes place. It causes lot of pain, inflammation. So you can one can easily differentiate between
Okay.
these two conditions.
Uh-huh.
Like osteoporosis is a non-painful situation
Oh.
until unless it causes a severe fracture.
Okay, so until
Whereas
that you
when
don't
we
feel
talk
pain.
about osteoarthritis, it is a very, I say, degenerative, painful, inflammatory
Okay.
situations.
So in osteoarthritis, it's a very painful process, while osteoporosis, it's unless it causes a fracture due to the bone depletion. Now, when you look at age factor, you see, age factor is a very important thing. When you look at age factor, can anybody at any age get osteoporosis?
It's a very tricky question. Yes, as I told you, there are conditions, medical conditions, there are certain drugs who can cause these symptoms of osteoporosis early also.
Okay.
But yet, when we talk about the surgeon after menopause in the woman,
Right.
they become more prone for the osteoporosis.
Right.
And after like 50 plus, when your bone mineral density is prone to less, you are not supplementing your diet with these rich. That's how they end up
Okay.
in catching this osteoporosis.
If we have a look at the complications that are there, you see osteoporosis is a risk factor in itself for fractures.
Yeah.
And it's a very common cause.
Yes,
Actually, statistically they say almost 33% of people who have gotten a fracture after due to osteoporosis, they die within a year if it's not taken care of well. So that's a huge amount of people. So my question is, osteoarthritis, what is the complications that can be caused later on if somebody doesn't manage it well, for example?
Okay. No. As you told, that osteoporosis causes fractures,
Right.
leads to lack of mobility.
Okay.
Or limit mobility.
Okay.
Same way, osteoarthritis, if not taken care of in a nice way, it causes pain
Okay.
and leads to mobility, leads to limitation of mobility. The person becomes less mobile,
Okay.
prone to have more weight,
Okay.
causes more damage to the cartilages,
Okay.
and it becomes, that's how and once the mobility becomes at risk,
Right.
when the person is not mobile,
Right.
it becomes very difficult for a person to take care of their daily course.
So this is what happens at the end
Yes,
of the
it
day.
becomes a chain. I
Becomes
should
a
say.
chain reaction.
Chain.
Okay. Would you maybe elaborate more on the diagnosis? So what tests somebody can do to know whether he has osteoporosis, at the same time test for osteoarthritis?
There's a very simple, non-painful test
Okay.
for osteoporosis.
Okay.
We all can go for it. And this is called the bone mineral density test.
Okay.
And normally it measures the strength or the density of bones, and anybody can go for it and can understand that he or she is at the risk factor of the osteoporosis or not.
Okay.
Whereas osteoarthritis, as we mentioned, is, you can see the physical examination.
Right.
There will be pain, inflammation,
Okay.
and a simple test like X-rays can help in understanding that one person is suffering from osteoarthritis or not.
Okay.
The main joints,
Yes.
the main joints where osteoarthritis is of knee, hip, and spinal.
Knee, hip, and spinal.
Spine.
Okay.
So I think it's almost, as you say, the data, the statistics say
Yes.
that almost every third woman suffers from backache. They say
Yes.
backache.
Yes.
So backache is what? Osteoarthritis of lumbosacral joints of
Okay.
spine. So that's how you can buy it done, or the spondylitis of neck.
Okay.
Cervical spondylitis.
Yes.
So they are all the degenerative changes.
Oh.
If they happens, one should go for the X-rays, then for the treatments.
Okay. We looked at the complications, the risk factors, the diagnosis. Would you elaborate more and tell us about how a person knows that he has osteoporosis or osteoarthritis? Now, before he goes to do any diagnosis, how can he himself maybe recognize that he has this problem?
If a person is suffering from pain, joint
Okay.
pain, he can see he's having inflammation,
Okay.
and he's having difficulty in walking, in mobility.
Okay.
That person can understand that he or she is in the risk of osteoarthritis.
Okay.
Right?
Right.
Whereas, and then he or she can go for the X-rays and other tests. Whereas, if the person is meeting small fractures, falling more occasionally, and understanding that his or her diet is not balanced,
Correct.
he is not having living a healthy life, like
Right.
going for the morning walk and living a healthy life, that person is certain to be prone to be of most of
Osteoporosis.
osteoporosis.
Okay. Now, let's say somebody has recognized himself having either of the diseases, he has gone to get a diagnosis, and he has found out he has this problem. So, what are the management he can take? Now, I want us to look at both the medications, the surgical options, and finally the lifestyle modifications.
Yes, yes. So, Dr. Sajid, lifestyle modification plays a lot of role
Okay.
in osteoporosis. It is said
Okay.
that prevention is always better than the cure.
Correct.
So, when we talk about the management of
Okay.
osteoporosis, it can be treated with the lifestyle changes
Okay.
and with use of medication.
Okay.
And when one pays attention to the diet, it
Yes.
should be rich of calcium and vitamin D diets. Physical activity should be included for one's own daily course. And if there are fractures, they should be well treated with surgical repairment. They should
Okay.
not be ignored.
Okay, they shouldn't be ignored.
Yeah.
You mentioned that again for osteoporosis, somebody should have a diet rich in calcium. For the viewers, could you explain what foods they should include, and at the same time, if somebody is vegetarian, what would be a diet high in calcium for them?
Yes, yes. When we talk about the calcium-rich foods or diets, there can be two sources,
Okay.
animal and plants.
Yes.
So when we talk about the animals, the best source of calcium from animal source is milk,
Milk. Okay.
which I think all of us in a one form or the other
Or the other.
is able to consume. But sometimes we don't consume it in a proper amount.
Right.
Like an adult
Yes.
needs a minimum 400 milligrams of calcium per day.
Per day.
Yes.
Okay.
Whereas certain conditions like pregnancy, lactation, where a mother needs to feed a baby, this calcium requirement goes very high.
It increases.
Yes, and it sometimes increases the double fold. Like
Oh.
in conditions like lactation,
Yes.
women need 1000 milligram calcium per day.
Per day.
Yeah.
Okay.
Because the baby's milk, the supply, the calcium, all the baby's calcium supply depends upon the
On the
mother's
mother.
intake. And if the
Okay.
mother's diet is insufficient, what happens? It is in the risk of osteoporosis.
Oh, okay.
Yes. The calcium, the milk for the baby, it takes from the mother, it goes to the baby, but the mother suffers the loss.
Suffers the loss. Okay.
So that's how at that time, even when the diet is also insufficient, there's a procedure to supplement it with the medications, calcium supplements, vitamin D supplements,
Okay.
patients. When we talk about the diet,
Right.
milk, buttermilk, yogurt, cheese, they are very good sources of
Calcium.
calcium.
Okay.
Fishes like salmon
Right.
with bones. They are also very good source of calcium.
Okay.
And when one keep on including these diets in one's daily food, that means the supplementation is proper.
Yes,
Still, one need to sometimes go to the nutritionist or doctor to assess the supplementation and how is it. When it comes to the plant, like as you say, there are people who are vegetarians.
Yes.
So, except for the milk, when we come to the plants, lot of leafy vegetables
Okay.
like amaranth, fenugreek, and
Okay.
what they say, locally available
Yeah.
greens,
Spinach as well.
spinach, chicha, they say.
Yes.
They're very good source of calcium.
Okay.
Yeah. Except that green leafy vegetables, cereals. Cereals
Okay.
are also very good source of, one of the very good sources of calcium.
Calcium.
Yeah. So when we combine one's diet with cereals, fruits, vegetables, and they provide not only the other balanced nutrition
Right.
of protein and
Other minerals.
but they also end up in providing these irons, calcium,
Okay.
and microelements which are
Okay.
needed in the diet.
Now, this is for somebody who has osteoporosis. Is there any lifestyle management for somebody who has osteoarthritis?
Yes.
Okay.
When we talk about the lifestyle of osteoarthritis,
Yes.
first thing is that to understand one is having osteoarthritis, rest of
Okay.
that particular joint.
Okay.
Then there are strengthening exercises for for the muscles,
Okay.
so that they can put a less strain on the joints, and so muscle training is also there for
Okay.
the people who have the osteoarthritis.
Okay.
Yes, and plus balanced nutritive diets who are supplemented with the vitamins like
Okay.
C, E, D, and minerals.
And minerals.
Yeah. And if at the extreme cases, like joints are very much depleted, they are not in the good conditions, they say the knee and hip replacement joints are also available. They are
Okay.
very most common joint replacement therapy doctors are performing nowadays, so they can take help of these.
Okay. Somebody has osteoarthritis. What are the type of medication he uses?
Osteoarthritis mainly, as I told you, it is the inflammatory
Correct.
disorder.
Yes.
So we take drugs, painkillers, anti-inflammatories, NSAIDs. Plus, when we talk about diets, there are certain foods who act as an anti-inflammatory.
Okay.
And there are a lot of herbal products which helps up to much extent in causing and eliminating those inflammation. Like garlic.
Okay.
If you include these this small herb
Yes.
in your food every
Yes,
day,
right.
like the other way is turmeric.
Yes.
I myself have done a lot of research on these products,
Okay.
and we come to know that they actually help people up to much extent.
Oh.
The fenugreek, the turmeric, the
Right.
garlic, they are the anti-inflammatory foods.
So including these foods in your diet would help to a certain extent decrease the inflammation that is caused in the joints.
Yes. Plus, along with living the sedentary life,
Right.
which should be there, leading a more active life,
Active life.
Swimming, walking, brisk walk, and more out sports game, and so that's how one leads to more active life.
So at the end of the day, if we can safely say that diet and exercise
Yes.
is a lack of a good diet and exercise also contributes towards these diseases.
Yes, sedentary life is one of the most causative agent, I should say. Yes, yes.
Okay. Is there anything you would like to add to for our viewers?
Yeah, as a nutritionist, I would like to suggest my viewers to concentrate when you have osteoarthritis, diet rich on fibers like kidney beans, cereals, vegetables, fruits, who are rich in vitamin C and vitamin E.
Right.
And as I say, garlic, you can include food like anti-inflammatory foods, and lead a balanced life, eat a balanced food. Thank you.
So, Dr. Lekni, thanks a lot. And I believe we have covered a huge range, and we have discussed so many things on both osteoarthritis and osteoporosis. The comparison you have given us, I believe, will allow the viewers to see the differences. And we are looking forward for meeting again for next show. Until then, stay fit, keep healthy, and see you again.
Bye.